This is Chapter 5, Infertility, Contraception, and Abortion. What is infertility? Infertility is the inability to get pregnant after 1 year of trying, or the inability to get pregnant after trying for 6 months for a woman who is 35 years of age or older. Women who can get pregnant but are unable to maintain the pregnancy may also be considered infertile. What things do you think may contribute to infertility? Pregnancy. It's the result of the process of many steps. To get pregnant, you must have ovulation. This must take place. It's the release of an egg from the ovaries. The egg must travel through the fallopian tube to the uterus, the womb. The man's sperm must join with the egg, which is fertilization. Infertility happens if there is a problem with any of the above steps. Is infertility a common problem? Yes. Roughly 10%, 6.1 million of women in the United States suffer from infertility. What or how do you think the focus of treatment is for infertility? The focus of treatment for infertility has shifted from correcting the problem or the specific pathology to recommending and initiating treatment that would achieve pregnancy of a child for that couple. You may see page 110 in your book. Is infertility just a woman's problem? No. Both women and men can suffer the infertility issues. About 1/3 of infertility cases are caused by women's problems. Another 1/3 of fertility problems are due to the man. The other cases are caused by a mixture of male and female problems of unknown cause. What causes infertility in women? The most recognized cause of infertility in women are issues with ovulation. Some signs that a woman may not be ovulating normally are irregular or absent menstrual cycles. Less common causes of fertility problems in women include blocked fallopian tubes due to pelvic inflammatory disease, or PID, endometriosis, or surgery for an ectopic pregnancy, physical problems with the uterus, uterine fibroids, and non-cancerous tissue and muscles found in the wall of the uterus. What things increase a woman's risk of infertility? Age, smoking, excessive alcohol use, stress, poor diet, athletic training, thyroid disorders, pituitary or hypothalamic hormone disorders, adrenal gland disorders. If you see page 110 in your book, you may find more things that increase a woman's risk of infertility. What things increase a man's risk of infertility? Again, on page 111, you may see a list of things. Things such as hormonal disorders, tumors or trauma to the pituitary or hypothalamus, drug and substance abuse, chronic illness, obesity, endocrine disorders, and excess of androgens, estrogens, and cortisol. Again, there are many things that increase a man's risk of infertility. Some other things such as trauma to the testes, STDs, hypertension, taking medication for hypertension, ejaculation dysfunction, and premature ejaculation. Again, see a list on page 111. How long should a woman try to get pregnant before seeking expert help? Most experts suggest at least 1 year. Women 35 years of age or older should seek help after 6 months of trying. Remember, health problems increase the risk of infertility, so women should identify the following problems and report these to their doctor: irregular periods, very painful periods, a history of endometriosis, pelvic inflammatory disease, or more than 1 miscarriage. These all increase her risk of unsuccessful pregnancies. How will the doctor detect if a woman or her partner have fertility problems? Once seen by a physician, there's a physical exam, health and sexual histories of both partners, possible testing of a man's semen, women and men hormone levels are drawn, and for women, evaluating her ovulation schedule, and possible ultrasounds of the ovaries. Common tests of fertility in women. Number 1, you have your hysterosalpingography. It's an X-ray of uterus and fallopian tubes. The X-ray of the uterus and the fallopian tubes, they inject a dye into the fallopian tube and in the uterus through the vagina. This checks for any physical blocks keeping the egg or the sperm from freely moving about. The second test is a laparoscopy. This is a minor surgery to see inside the abdomen. Small incisions in the lower part of the woman's abdomen using a light and a camera to check for any disease, scarring, malformations, or possible endometriosis. Medications that are used to treat women's infertility. Number 1, you have Clomid. It causes ovulation by acting on the pituitary gland, typically given by mouth. Number 2, you have human menopausal gonadotropin, also known as Ripronex or Pergonal. It is used by women who do not ovulate due to problems with their pituitary gland. It acts directly on the ovaries to stimulate ovulation, given by injection. Number 3, you have FSH, follicle stimulating hormone, also used for women who do not ovulate regularly every month, acts on the pituitary to change when the body ovulates each month. It can be given by injection or by mouth. Number 4, you have metformin, also known as glucophage, restores cyclic ovulation and menses in women with polycystic disease, helps to lower the high levels of male hormones, and helps to regulate the body's ovulation. Be given by mouth. Medications used to treat female infertility continued. Number 5, human chorionic gonadotropin, also known as HCG, ovulation induction. It directly acts on the ovarian follicle. It's also given by injection. Number 6, progesterone, treatment of the luteal phase inadequacy, direct stimulation of the endometrium. It's a vaginal gel, continued through 10 to 12 weeks of pregnancy. And number 7, letrozole. It induces ovulation, acts on the luteinizing hormone and the follicle stimulating hormone ratio, and it's given by mouth. Now we need to discuss assisted reproductive therapies for those women who have difficulty becoming pregnant. There are 2 specifics, IUI and ART. IUI is intrauterine insemination. Specially prepared sperm is injected into the woman. The woman is also at times treated with medication prior to the IUI treatment to stimulate ovulation. ART is assistive reproductive technology. Removal of the eggs from the woman's body. The eggs are then mixed with sperm to make embryos and then placed back into the woman's body. When considering both of these, there are considerations that we should also think about when you're talking about infertility and reproductive therapies. Religious considerations. Many religious groups have different beliefs regarding IVF and IUI. Jews, Orthodox Jews, Roman Catholics, they have specific beliefs on this. And then civil law regarding sperm donors' rights and the parents' and the child's rights. As a fertility nurse, you want to be very specific in helping the couple to not only feel comfortable about this time, but also be knowledgeable. Help the couple to identify and treat possible causes of their infertility issues. The nurses be knowledgeable and provide education about medical, surgical, and drug options available to them. Provide emotional support. Help to guide the couple to support groups or advocacy groups to assist if needed. Help educate the couple on stress reduction. Guide and educate about other treatments such as IVF, surrogacy, donor eggs, and adoption. If you go to page 109 in your textbook, you can find more information regarding this. Contraception. What is contraception? It is defined as the intentional prevention of pregnancy during sexual intercourse. Birth control is a device and or practice utilized to decrease the risk of becoming pregnant. There are different types of birth control devices, and they're categorized in different ways. You have coitus interruptus, fertility awareness methods, barrier methods, hormonal methods, and then you have transdermal contraceptives, which is another form of hormonal methods as well. Coitus interruptus. This is where the male partner withdraws his penis from the woman's vagina before he ejaculates. Effectiveness is similar to that of the barrier method. There are advantages to this in that there's no use of spermicides, creams, or condoms. Some couples prefer this over any other method because it's more natural. Disadvantages of coitus interruptus: the failure rate is approximately 27%, and there is no protection against STIs or HIV. The fertility awareness method of birth control identifies the beginning and the end of the fertile period of the menstrual cycle. Women will need education on infertile phase, which is before ovulation, and the fertile phase of ovulation, which is 5 to 7 days around the middle of their cycle. Advantages to the fertility awareness method are low to no cost, and they use this to detect optimal timing for conception. Disadvantages are strict record keeping, outside influences on the woman's basal body temperature, vaginal secretions in women with irregular cycles, necessity of attending time-consuming training sessions, and the failure rate is approximately 24%. The natural family planning method of birth control is the only method of contraception acceptable to the Roman Catholic Church. Signs and symptoms most commonly used for abstinence with this method are menstrual bleeding, cervical mucus, and the basal body temperature. Avoid intercourse during fertile days. This is an umbrella term for many fertility awareness methods. Advantages: there are no use of hormonal, injected, surgically implanted devices. It relies strictly on the woman's cycle, basal body temperature, cervical mucus, and abstinence. Disadvantages of this method: exact time of ovulation is difficult to predict. Couples may find this method difficult to abstain from sexual intercourse for several days before and after ovulation. The calendar rhythm method is based on the number of days in each cycle. Counting from the first day of your cycle, the fertile period is determined after you have accurately recorded the length of menstrual cycles for 6 to 12 months. The beginning of the fertile period is estimated by subtracting 18 days from the length of the shortest cycle. The advantage of the calendar rhythm method is no cost. It is all natural. Disadvantages of the calendar rhythm method: trying to predict future events with past data. Unpredictability of a woman's menstrual cycle would make this very difficult, and education is needed. The standard days method of birth control is a modified version of the calendar rhythm method that has a fixed amount of days of fertility for each cycle. A cycle beads necklace can be purchased as a tracker tool to assist and track your fertility days. The woman is to avoid unprotected sex from days 8 to 19. This method is useful for women whose cycle is 26 to 32 days in length. Nowadays, one might also purchase a phone app for their phone that assists with this method. Advantages to this are low to no cost, natural, often chosen for this reason over hormonal or other implanted devices. Disadvantages to this: unreliable for women with shorter or longer periods, and education on how to use the cycle beads or the app are also needed. The basal body temperature method, also called the BBT, is the lowest body temperature of a healthy person taken immediately after waking. The BBT method of contraception measures the fertile period as the day of the first temperature drop, or first elevation, through 3 consecutive days of temperature elevation. Abstinence should begin the first day of menstrual cycle and continue through 3 consecutive days of elevated temperatures. Remember, the drop or elevation temperature is the measurement of your fertile period or ovulation. Advantages of the BBT: cost, inexpensive, natural, often chosen for this reason over hormonal or other implanted devices. Disadvantages of the BBT method: BBT can be affected by infections, disease, alcohol intake, sleep-wake patterns, fatigue, and anxiety. There's much needed education, and BBT alone is not a reliable predictor of ovulation. This is an example or picture of cycle beads' methods of contraception. This is a graph of a woman who utilized the basal body temperature method. You can see her fertile cervical fluid. You can see her fertile days in the green on the tracking chart. You can see her ovulation days, and then you can see where she tracked where she got pregnant. The cervical mucus ovulation detection method, also known as the Billings method or Cretan model, is also another method of birth control. The woman must recognize the cycle changes in the amount and consistency of cervical mucus. Without adequate cervical mucus, coitus will not result in conception. Intercourse is considered safe without restriction beginning the 4th day after the last day of wet, clear, slippery mucus. Indication of ovulation occurring 2 to 3 days prior. This method relies on the woman being educated and being able to recognize the right, correct consistency of cervical mucus. Advantages to the cervical mucus ovulation detection method: self-evaluation of cervical mucus can be highly accurate and useful diagnostically. To alert a couple to the return of ovulation during breastfeeding and after discontinuation of oral contraception. To note menopause, and to assist couples in planning a pregnancy. Disadvantages: factors causing difficulty in identifying mucus changes are medication, antihistamines, douches, sperm, and being sexually aroused. Some women may not want to touch their genitalia, and religious reasons and/or personal reasons. This is a chart and a picture depicting a cervical mucus ovulation detection method, and it shows a picture of a highly fertile, slippery wet mucus. The stages are shown on the chart as well. Dry to light moisture would indicate infertility, and highly fertile would be slippery wet mucus. Now we're going to discuss barrier methods of contraception. Spermicides, nonoxyl 9, also known as N9, work by reducing the mobility of sperm so the sperm do not reach the cervical os. Advantages of spermicides are cost and ease of use. Disadvantages of spermicides: the use of N9 as a lubricant during anal intercourse may increase the spread of HIV. Typical failure rate in the first year of spermicidal use alone is 29%, and the effectiveness of spermicides depends on the consistent and accurate use, which means the people using spermicides need to be highly educated on the use of the spermicide. Also, women with high-risk behaviors are advised to avoid the use of spermicides containing N9. Another barrier method are condoms, thin stretchable sheaths that cover the penis before genital, oral, or anal contact and is removed once the penis is removed from the partner's orifice and after ejaculation. Advantages of condoms are cost and ease of use. They provide a barrier for STIs, non-spermicidal latex only. Disadvantages of condoms: some natural condom products do not protect against the spread of STDs, STIs, and HIVs. Proper use is imperative, so education is needed. Latex condoms break down with oil-based lubricants, so they should be used accordingly. The female condom, natural non-latex flexible pouch with a closed end that is inserted into the female vagina opening. The open ring covers the labia. The diaphragm, it is a shallow dome-shaped latex or silicone device that covers the cervix, is a mechanical barrier. Disadvantages: placement, messiness of spermicide, that can cause decreased sexual stimulation if placed just before sexual intercourse, must be fitted yearly. Cervical cap fits at the base of the cervix. physical barrier to sperm. Recommended to remain in place no less than 6 hours and no more than 48 hours. No additional spermicide is needed for repeated intercourse. Advantage of the cervical cap: no additional use of the spermicide. Ease of use, convenience. Disadvantage of the cervical cap: less effective than the diaphragm. Education should be provided. There is also a potential risk of toxic shock syndrome, TSS, if used during menstrual bleeding and up to at least 6 weeks after birth. Contraceptive sponge. Polyurethane round sponge containing N9 spermicide. It fits over the cervix. Protection for up to 24 hours. Must be worn for at least 6 hours after intercourse. Advantages of the contraceptive sponge: protection up to 24 hours, protection for repeated instances of sexual intercourse. Disadvantages of the contraceptive sponge: risk for TSS if worn longer than 24 to 30 hours. Failure rate is greater than that of the diaphragm. Do you see any trends with the barrier methods? Education is needed. If they don't know how to use the products properly, it increases the failure rate. These are all pictures of female and male condoms, diaphragms, and cervical caps. All pictures of barrier methods. Now let's discuss hormonal methods. Many oral contraceptives combining estrogen and progesterone are available in the U.S. today. The advantages of an oral contraceptive for women are the convenience. Sexual satisfaction improved once the possibility of pregnancy is no longer an issue. Disadvantages of oral contraception are the cost, need for education. Side effects can include heart disease, headache, weight gain, blood clots, hypertension, irregular bleeding, depression, and nausea. What happens with an oral contraceptive is regular ingestion of the oral contraceptives suppress the action of the hypothalamus and the anterior pituitary, leading to insufficient levels of follicle-stimulating hormone and the luteinizing hormone. The follicles do not mature and ovulation does not take place. Let's discuss nursing considerations for oral contraception. Education should be provided to the woman with regard to reading the package inserts. They should follow the directions for missed doses. Educate women, if taking oral contraceptions, to always take them at the same time each day. Signs of potential complications of oral hormone contraceptive agents could be headache, chest pain, abdominal pain, eye problems, or severe leg pain. You can go to your text to page 131 and see this. Oral contraceptives do not protect against STIs or HIV. Okay, let's talk about the transdermal patch. It is also a hormonal birth control. It delivers continuous levels of progesterone. It's applied to the torso, applied once a week for 3 weeks on the same day, applied to a different site every time, never applied to the breast area. The woman will have withdrawal bleeding during the no patch week. Advantages are convenience. The failure rate is under 2%, so it's highly successful. Disadvantages are it is a hormone. Remember to apply the patch, so they have to remember to put it on. Side effects of the hormone are the same as those for oral contraception. You can see this information in your text, page 130. The vaginal contraceptive ring delivers continuous levels of progesterone. Worn for 3 weeks, the ring can be replaced by the woman. It does not need to have fitting. Advantages are convenience. Some users report relief of vaginitis. Failure rate is low, it's 2% for the first year. Disadvantages: pain reported by some users and felt during intercourse reported by some users. Also, you can find this information on page 131 of your text. Injectable progestins, Depo-Provera is an example of this. It may be given subcutaneously or intramuscularly in the deltoid or gluteus maximus muscle. It is initiated during the first 5 days of the menstrual cycle and every 11 to 13 weeks. It's good for women who cannot remember to take oral contraception. Advantages: contraceptive effectiveness comparable to that of oral contraception. It requires injections only 4 times a year. It is unlikely that lactation would be impaired, and the failure rate is 3% in the first year. Disadvantages: side effects include decreased bone density, weight gain, lipid changes, increased risk of DVT and thromboembolism, irregular spotting, decreased libido, and breast changes. No protection against STIs and HIV. Return of fertility could be delayed up to 18 months. Nursing alert. Please remember when giving this injection, never massage the site. This will hasten the absorption of the medication and shorten the effectiveness. What is emergency contraception? This is a type of birth control that can prevent pregnancy after unprotected sex. There are different types. Ella, Plan B one-step, Next Choice are some of the examples. Plan B one-step and Next Choice are FDA approved for over-the-counter sale for women 17 and under. Ella is available with prescription. You may see this information on page 132 of your textbook. How does emergency contraception work and how is it effective? Depending on where you are in your cycle, it may prevent or delay ovulation. It may interfere with fertilization of an egg. Must be taken ASAP or within 72 hours of unprotected sexual intercourse. The EC method contraception will not protect against pregnancy in the days and weeks following treatment. Effectiveness studies have shown moderate amount of effectiveness between 72 and 120 hours, but no data for after 120 hours. This information is found on page 132 of your text. The copper IUD is also used for emergency contraception if used within 8 days of unprotected intercourse. The IUD, intrauterine devices. There are 2 IUD devices that can be placed by a physician. IUD, T-shaped copper device with strings protruding into the vaginal canal so the woman can assess to keep it from being dislodged. It is approved by the FDA for use for 10 years. The copper IUD is a spermicide and inflames the endometrium, preventing fertilization. Advantages: 10-year use. Failure rate of 0.8%, and it is reversible. Constant contraception with no need to remember to take a pill. Disadvantage: pain, bleeding, risk of infection, risk of PID, uterine perforation, no protection for STIs and HIV. Spontaneous expulsion is a common problem with an IUD. The IUD Mirena releases levonorgestrel, impairs sperm motility, irritates the lining of the uterus. Advantages: it's effective for 5 years. Cramping and bleeding decrease with this device. Failure rate is 0.2% the first year. Constant contraception with no need to remember a pill. Contraception effective is reversible. Possible advantage: light spotting, amenorrhea. Disadvantage: spotting implanted device, increased risk of PID, uterine perforation, no protection against STIs or HIV. Signs of potential complications. Most common are P for period late, abdominal spotting or bleeding, A for abdominal pain, pain with intercourse, I for infection, exposure, abnormal vaginal discharge, N for not feeling well, fever or chills, and S for string missing, shorten or longer. Acronym: PAINS. Remember, you need to teach the woman a common problem can be spontaneous expulsion, so she should always be checking for that string. This is a picture of an intrauterine device. You see the copper T, and you also see the Mirena. Nursing considerations for IUDs. Again, teach the woman to check for the presence of the IUD threads following her cycle to note expulsion. If pregnancy occurs, the IUD should be removed immediately in the first trimester. If later in a pregnancy, ultrasound should be completed to locate the IUD and rule out placenta previa. Educate on the risk of septic miscarriage and ectopic pregnancy. Also, always check for allergies to copper. Sterilization. Sterilization is a surgical procedure which is intended to make a person infertile. Women, uterine tubes are usually occluded. Complete sterility is removal of the ovaries, an oophorectomy, or uterus, hysterectomy, or both. Tubal ligation may be done 24 to 48 hours after giving birth. Average failure rate is 0 to 5%. It's usually done on an outpatient basis. Tubal occlusion is the use of bands or clips, may be removed at a later date. It's less permanent. Tubals do not offer protection against STIs. Women do not have hormonal changes with tubal ligation. Sterilization for men. This is done by vasectomy, which is a sealing, cutting, or tying of the vas deferens so sperm cannot travel from the testes to the penis. It's the easiest and most common form of sterilization in men. An advantage is it can be done on an outpatient basis. Recovery is fairly quick, and it can be done under local anesthesia. Disadvantage: pain, infection, bleeding, and other post-surgical complications. Failure rate is 0.15%. Both conventional and non-scalpel approach methods are used. It has no effect on the ability to achieve or maintain erection or secondary sex organs. Nursing considerations for any or all types of contraception. Nurses need to educate the patient. Informed consent. What is it? They need to know before they sign. Provide information about alternatives. Contraceptives versus sterilization. Provide education about pre- and post-operative care to the patients who are receiving surgical procedures. All of this information could be found in your textbook on page 135. Abortion. Induced abortion, which is also known as elective abortion, is purposeful interruption of the pregnancy before 20 weeks gestation. Spontaneous abortion, also known as a miscarriage, and therapeutic abortion is abortion completed due to maternal or fetal health reasons. An ultrasound should be performed before the second trimester abortion is completed. If the woman who has an abortion is Rh negative, she should receive the Rh immunoglobulin within 72 hours after the abortion is completed. Types of abortion. There's surgical aspiration, which is typically performed in the physician's office under local anesthetic. It's performed by the physician 8 to 12 weeks after the last menstrual period. Medical abortion is completed up to 9 weeks after the last menstrual cycle. This is completed by giving a cytotoxic drug, methotrexate or RU486. It blocks the action of progesterone, which is needed to maintain a pregnancy, given orally or by intramuscular injection. The woman requires a follow-up visit to confirm the abortion, repeat medication if needed, and vacuum aspiration any products of conception that may be left. When discussing abortion, we always have to consider the ethical, legal, cultural, and religious considerations. The Association of Women's Health, Obstetrics and Neonatal Nurses, AWON, supports nurses' right to choose whether to participate in abortion procedures in keeping with his or her personal, ethical, and religious beliefs. AWON also advocates nurses have a professional obligation to inform his or her employer at the time of employment of any beliefs or attitudes that may interfere with their job duties. If you do not wish to participate in any abortion activities, you do not have to do so, but it is your responsibility as a professional to inform your employer of this at the time of employment. There are specific nursing interventions and nursing education that you would provide for a woman who has received an abortion. You must educate the woman she will have menstrual type cramping, menstrual type bleeding. She may receive prophylactic antibiotics. An infection such as endometritis or salpingitis is also a risk. Avoid tampon use for up to 3 weeks. Avoid sexual intercourse for 3 days up to 2 weeks. She should not douche at all until released to do so by her physician. Watch for excessive bleeding greater than 2 saturated pads in 2 hours. If she has saturated pads greater than 2 pads in 2 hours, she needs to call her physician immediately. Watch for foul-smelling vaginal discharge. Chills and fever greater than 38 degrees Celsius could mean that she has a severe infection and she must call her physician immediately. Severe abdominal pain is a sign that something is wrong, and she must also call her physician for this immediately. Abdominal tenderness when pressure is applied, she needs to watch for this as well. You can find all of this information in your textbook at page 137.